So I'll start with doctors. Doctors get, throughout medical school, they are lucky if they get half a dozen hours of education in the area of pain, in spite of the fact that it's the #1 complaint that brings patients to doctors. And so the doctors really don't have much formal education. What they do learn, they typically learn in their residencies just by observing the more senior doctors who also never had formal training in it. So we're kind of generation to generation propagating this lack of training and education in pain. And one approach, frankly the only approach to really getting advanced education, has been to do a fellowship. But how many people want to do that? That's only if you want to be a pain specialist. And so we believe that the family physician, the general surgeon, the psychiatrist, there's the pediatrician, that all the medical specialties deal so much with pain that they can benefit enormously by advanced education. I should say what it's not. It's not a fellowship. So it's not that after taking a certificate program in pain medicine or a master's degree in pain medicine that somebody now sits for a board exam and becomes a board certified specialist. This is instead a certificate or an advanced degree showing that somebody has developed an area of academic and intellectual knowledge and expertise that they can apply in their own practices, in their own fields, no matter what that field is, in a clinical field. In the non-medical fields, nursing, dentistry, psychology, all these others, it's even worse because they don't even have fellowships available. So there is essentially no advanced pain education available to all these clinicians. And so we are putting together a program that is aimed at all of these clinicians, taught by these clinicians and aimed at these clinicians so that people can apply pain knowledge whatever their clinical field is. And then I'll make it even more extensive and say that outside of the United States, it's even thinner. Certainly once you get outside of the Western countries, there's very, very little education available in the pain medicine, pain science. And one of the beauties of today's technology is that education can be delivered online just as effectively as it can be delivered, in the auditorium and in the classroom. And that's what we're striving to do. USC has a policy that online education has to be completely as rigorous and as quality equivalent to being in the classroom, and that's what we're going to deliver.